And then Tommy told me, "Doc, I saw that you prescribe a lot of medicines for weight loss. I'm not interested in medicines. I just want to exercise and eat right." And this is where I felt sad. Why? Because our system, our healthcare system, and especially our social media system have failed patients like Tommy. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. So Tommy comes into the clinic to see me. Tommy is 160 pounds overweight. And when we get to discussing the weight, Tommy tells me, "Doc, I actually picked you because you specialize in obesity." And I was happy. I'm like, "Yes, welcome, Tommy, because that is what I do. That's my passion." Now, I am a primary care physician. I treat all types of conditions. But I love helping patients achieving their weight loss goals. And then Tommy told me, "Doc, I saw that you prescribe a lot of medicines for weight loss. I'm not interested in medicines. I just want to exercise and eat right." And this is where I felt sad. Deep, deep sadness as a physician. Why? Because our system, our healthcare system, and especially our social media system have failed patients like Tommy. Let me explain to you why. Obesity is a chronic disease, and that's how we physicians look at it. But it's not just a disease on paper. It's a disease that happens in people's lives. But very often, patients do not understand a critical connection. And that's the connection between obesity and depression. Many studies have shown that obesity alone increases the risk of depression by 50%. And people who are obese have twice or thrice rates of depression as compared to the general population. And the most important thing that a lot of doctors and a lot of patients and a lot of psychiatric practitioners do not understand is the link between obesity, depression, and the connecting factor, the bridge between them, emotional eating. So consequently, when a patient goes to see a doctor to be helped with weight loss, the first thing they do is, "Let's talk about your exercise regimen. Let's talk about diet. Maybe let's talk about the medication to help you lose weight." But the patient's mental health is an afterthought. But that is the most important issue. That is why my colleagues and I in this practice, we always start by looking at your PHQ-9 and your GAT-7 questionnaires. When you weigh more than 50 pounds from your baseline, we routinely refer you to our psychiatric nurse practitioner or therapist. Why? Because emotional eating is usually the bridge between obesity and depression, or depression and obesity. And this is because both conditions have a shared biology. Alterations in inflammatory hormones, alterations in pleasure reward systems in the brain, alterations in inbuilt environments, they all lead to a connection between depression, anxiety, trauma, emotional eating, and obesity, or vice versa. Obesity, emotional eating, depression, anxiety, trauma. These are things that actually happen to people every day. And that's why when a patient sits down and says, "Doc, I have no idea how I gained 150 pounds. And we start breaking it down, they always sit back and say, "Wow, now I see it. I can see it now." I remember one patient, Brandon. We had the same conversation. And at the end of it, he told me, "Doc, no one has ever put this in these terms to me, but you are right." And guess what? After he started seeing our psychiatric nurse practitioner and the therapist, he lost 15 pounds the first month. The next month, he lost 12 pounds and has been going on and has been changing his life. Because what you see as obesity sometimes can just be depression, anxiety, childhood trauma, masquerading as 150 pounds. But this is not your fault. As a doctor, I always tell my patients, this is not your fault. You are not weak. You did not just love food and just ate without control. And I know when patients see you overweight or obese, they immediately assume that you are somebody who is just out of control, cannot say no to food. But it's because most people miss the big picture. The real picture is that there is an underlying problem. There is depression. There is dissatisfaction with life. There is trauma at work. There is stress at work and at home. All these things eventually lead patients and people to eat without control. That is why you must establish a strong relationship with your doctor so that you guys have time to go through the entire weight loss journey and the entire weight gain journey that happened before we contemplate weight loss. You need comprehensive care. You need the full, total review of your mental health. You need a doctor who works hand in hand with you to achieve these goals. And this is what I want you to take away from this episode. Weight gain is not always about gluttony. It's not always about just eating food because food is there. It is also about depression, anxiety, trauma that go untreated and eventually lead to emotional eating and eventually lead to excess weight. So if you weigh more than 50 pounds from your baseline, or even less than that, or you recognize that there is something happening in your mental health that is leading to overeating, make sure you talk to your primary care physician. Make sure you get referred to the appropriate mental health providers like psychiatrists and therapists. Make sure medications to deal with these conditions are adequately assessed, and if you need one, they are prescribed. And the final takeaway is that remember, the best treatment for mental health conditions is a combination of psychotherapy, that is talk therapy, and pharmacotherapy, that is medication. All of that only works if you take the bull by the horns and understand the relationship between mental health conditions, emotional eating, and excess weight. Okay? I hope you found this helpful. I will see you next episode because the fight does not stop here. We have to keep pushing until we achieve optimal health care. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Tacken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.